Hello, my name is Stephanie, and today I will go over prenatal education for a healthy pregnancy. I'll start off by entering my patient's room. I will close the door behind me to ensure patient privacy. I will perform hand hygiene. Hi, my name is Stephanie, and I will be your nurse today. Can you please verify your full name and date of birth for me? All right, I went ahead and verified my patient using two patient identifiers. By the way, I also want to say congratulations on your pregnancy. So today I will go over some important information to help you experience a healthy pregnancy. Is that okay with you? All right, sounds good. So to start off, prenatal care is important because it helps keep both you and your baby healthy throughout the pregnancy. Regular prenatal visits allow your healthcare provider to monitor your health, track your baby's growth, and identify potential complications early on. Most pregnant patients will see their provider every 4 weeks until 28 weeks of pregnancy, every 2 weeks from 28 to 36 weeks, every week from 36 weeks to delivery. During these visits, your provider may check your weight, blood pressure, test your urine for protein, check for signs of infections, and glucose levels. They will also listen to the baby's heartbeat. Common prenatal tests include, during the first trimester, include a blood test to determine blood type or H factor, anemia, immunity, and infection. Urine testing is also performed. From about 10 to 14 weeks, optional genetic screening tests to identify potential chromosomal abnormalities. From 18 to 22 weeks, anatomy ultrasounds to evaluate the baby's growth and development. From 24 to about 28 weeks, a glucose screening test to check for gestational diabetes. And from 35 to about 37 weeks, a screening will be done called GBS to determine if an antibiotic is needed during labor. Eating healthy, having a balanced diet provides the nutrients the baby needs to grow and develop while helping you stay healthy as well. You should choose to eat fruits and vegetables, whole grains, lean protein such as fish, chicken, beans, and eggs, and you should stay hydrated by drinking plenty of water. These foods contain important nutrients to include during pregnancy, such as folic acid, which helps prevent defects that affect the baby's brain and spinal cord, iron, which helps prevent anemia, calcium, which helps build strong bones and teeth, vitamin D to help absorb the calcium, and protein to help support growth of the fetal tissue and organs. A prenatal vitamin and supplement is recommended every day during pregnancy because it helps fill nutritional gaps. It also promotes a well balanced diet. It should be taken daily unless otherwise directed by your healthcare provider. Regular exercise during pregnancy is safe for most women and it offers many benefits for both mom and baby. It can improve circulation, reduce stress, improve sleep, and help relieve back pain. Most pregnant women should aim for about 150 minutes of moderate exercise each week or 30 minutes a day, 5 days a week. If you were not active before your pregnancy, you should start slowly and gradually increase your activity level. Of course, after discussing this with your healthcare provider, safe exercises during pregnancy include walking and swimming, prenatal yoga. Walking is one of the easiest and safest forms of exercise. It helps improve circulation and overall health. Swimming helps support your weight and it reduces pressure in your joints. Prenatal yoga can improve flexibility, posture, while also helping to reduce stress. While exercising, it's important to stay hydrated before, during, and after exercise. It is recommended that you wear comfortable clothing, supporting shoes to avoid injuries or falls. You should avoid overheating, especially during the first trimester. It's important to avoid certain sports such as soccer, hockey, and basketball. because of the risk of injury to the abdominal area. You should avoid activities with a high risk of falls, such as horseback riding, skiing, and gymnastics, because it increases the risk of injury. Yoga, saunas, hot tubs should be avoided because overheating can become harmful to the baby during early pregnancy. You should stop exercising um, and contact your provider if you experience vaginal bleeding, chest pain, and severe abdominal pain. The amount of weight you should gain during your pregnancy depends on your pre-pregnancy BMI, and following these next guidelines will be important to develop your baby's growth while developing any complications. If your pre-pregnancy BMI was less than 18.5, the recommended weight gain is around 28 to 40 pounds. If it was 18.5 to about 24.9, it's 25 to 35. If your pre-pregnancy BMI was 25 to 29.9, the recommended weight gain is 15 to 25 pounds. And if it was greater than 30, the recommended weight gain is 11 to about 20 pounds. Healthy weight gain supports your baby's growth and development, and it helps reduce the risk of pregnancy complications. Gaining too little weight may increase the risk of low birth weight, premature birth, and nutritional deficiencies. On the other hand, gaining too much weight may increase the risk of gestational diabetes and high blood pressure, and it may yield a difficult labor. Your provider will monitor your weight gain throughout the pregnancy. You should focus on eating a balanced diet rather than eating for two. Three common complaints during pregnancy include nausea and vomiting, aka morning sickness, constipation, and back pain. Nausea and vomiting are common during the first trimester, and they improve with small, frequent meals and avoiding greasy foods. Constipation is common because pregnancy slows digestion, and it may improve with fluids, fiber, and activity. Back pain is common as well, a common complaint as the pregnancy progresses, and may improve with good posture, supportive shoes, and gentle stretching. It's important to contact your healthcare provider right away if you experience any of the following warning signs during your pregnancy. The first one is vaginal bleeding. If at any point during your pregnancy you experience vaginal bleeding, let your provider know because it may be a sign of a miscarriage or problems in the placenta. If you do experience leaking of fluid from the vagina as well, please contact the provider as it may indicate that the water has broken, and it can also indicate an increased risk of infection and possible preterm labor if it happens before 37 weeks. If you experience severe headaches, vision changes, blurred vision, sudden swelling of the hands or the feet or in your face, or upper abdominal pain, please go ahead and contact again the provider. These symptoms may be signs of preeclampsia, which is a serious pregnancy complication that involves blood pressure that can be dangerous for both the mother and the baby. And as well, decreased fetal movement later in pregnancy should also be reported to your provider. All right, this is the end of our educational session. Do you have any questions for me? No questions? Sounds good. So can you tell me one or two things that you learned today? All right, excellent. Very well. So I will leave the call light next to you. Please call if you need me. I will perform hand hygiene. I will exit the patient room, and I will document my educational session.